Hello, Miss Davis.
Hi, Doctor.
Please, come in and take a seat.
Thanks.
So, my name is Dr. Cole, and I am the consultant in obstetrics and gynecology, specializing in fertility medicine. It's nice to meet you.
Hi, Dr. Cole. Please, call me Sue.
Alright then, Sue. How are you today?
I'm very well, thank you.
Excellent. I have received a letter from your GP stating that you would like to have IVF treatment.
Yes, Doctor. I want to have a baby, and I'm now ready to have a baby. I had a cancer 4 years ago now, and I never thought that I would have this opportunity. And now that I do, I know that I'm ready, emotionally and financially. I've discussed this with my GP.
Okay, Sue. I am glad to hear that you feel ready for a baby. Medically, I can see from your notes that you are currently fit and well. It mentions here that your eggs were harvested and fertilized with your partner's sperm. Can I ask whether the embryos were frozen before you started chemotherapy?
Yes, we were told my eggs would be more viable if they were fertilized and then frozen. Derek, who was my boyfriend, and I had a relationship for 8 years, but we separated. But I still want this baby.
Okay. Have you spoken to your ex-partner about this recently, or even at all?
Yes. Well, we spoke about this before, although I guess not since we broke up. Is there a problem? I thought he'd already given consent, so I didn't think I needed to speak to him.
Sue, unfortunately, your ex-partner Derek, he has retracted his consent to use the embryos that you both created.
What? I don't understand. He agreed. We've got it in writing.
Yes, he did give his consent at the time of the harvesting of your eggs. However, now that your situation has changed, he has now withdrawn his consent for implantation to go ahead.
But,
I am very sorry to have to tell you this, but we are unable to continue with the IVF.
but he doesn't even need to be involved. I can raise this baby by myself.
Unfortunately, Sue, without his consent, we are unable to proceed at this point. Under the terms in the Human Fertilization and Embryology Act, which regulates these procedures, either yourself or your ex-partner can withdraw consent to use the embryos. This is possible up to the point that the embryos are implanted in your womb.
What will happen to the embryos?
Unfortunately, we would have to destroy them. We are no longer able to keep the embryos in storage. However, the government does recommend a cooling off period of a year after people make decisions like this. This would have been explained to your ex-partner. I know this is a lot to take in. Since you haven't spoken to him yet, maybe it is best to talk to him about this. One thing to bear in mind, however, is that there are other options, and I would be very happy to discuss these with you.